them from any form of exercise or activity. So today, Baptist Health is here to explain some options if your weight is holding you back. And joining us today, Baptist Health bariatric surgeon Dr. Clay Wellborn and his patient, Carrie Kirkendall, who may look familiar because she's in Baptist Health's new branding campaign that's called Keep On Amazing. And you are amazing, Carrie.
Thank you very much.
Yeah, welcome, doctor, as well. But let's talk about you first and sort of what was your life like before bariatric surgery?
My life before bariatric surgery was not the lifestyle I wanted to live. You know, I weighed 300 pounds.
Wow.
And I couldn't do the things that I wanted to do. It was really holding me back from living, you know, my ankles would swell, you know. I didn't feel good. I was almost diabetic, you know, high blood pressure, you know, and I wanted to get outside and do things. And there was, at 300 pounds, my health was bad.
Yeah. How did you find Dr. Wellborn and why did you choose him in Baptist Health?
I have a very good friend of mine that chose Dr. Wellborn, and me and her had a conversation over lunch and told me that I needed to go and talk to Dr. Wellborn.
Yeah. Well, and I'm glad that you did, and he's glad that you did. Dr. Wellborn, talk a little bit about, you know, there are a lot of people like Carrie before the surgery who just can't do what they want to do.
And that's probably the biggest reason that we see people who have multiple medical issues, high blood pressure, diabetes, arthritis. All of these are impacted by weight. But the biggest thing I see is the quality of life. And Carrie and I have talked about this, and I've talked about with numerous other patients that at some point people kind of reach a moment of clarity where they realize, hey, this weight is holding me back, and this is as good as it's going to get unless I go and do something about it. And that's when they start exploring their surgical options, and we have much more of them now.
She was a good candidate, but not necessarily everybody is a good candidate.
Not necessarily everybody is a good candidate, but again, we're finding we can push the limits on that because anything we can take off is going to go and help. But it's like everything else, early treatment of cancer, early treatment, early detection of heart disease. We're trying to get to people early before they become, you know, basically disabled. But
we have some pictures of Carrie. You love horses, and talk a little bit
horses.
about your life now that you've lost so much weight.
My life now is wonderful. I thank God every day for the life that I have, and I thank God for Baptist Health and Dr. Wellborn, because without their help and you know, I would not live this life. I dreamed of being a barrel racer my whole life, and I have a horse. His name is Snippersburg. And he is wonderful.
You're living your dreams now.
And I'm so living my dreams.
Before we run out of time, Doctor, what's the process for somebody contacting you and Baptist Health to look into this?
The easiest thing is to go to baptisthealth.com, and there's a link to the bariatric surgical site. There are several other bariatric surgeons besides me, excellent surgeons, and a great team to help people on their weight loss journey. And that's how I'd start.
Absolutely. Okay, there's the information on the screen where you can go to baptisthealth.com, find out more information like Carrie did, and you may continue to see her in commercials and magazines as well. She's a real celebrity now. So thank you for being here.
Thank you for having me.
And thank you, Doctor, as well.
Thank you.
Back in just a moment, we're going to check on your weather forecast.
Look at his twiddling his thumbs.